Hello, Tara.
Hi.
How are you doing today?
I'm doing okay. How are you?
Doing good. Doing good. I'm Lauren. I'm going to be your student physical therapist today. I'm going to be helping you out today, okay?
Okay.
Is that all right?
Yes.
Okay. So, is it all right if I ask you a few questions just to see what's going on
Sure.
and what brought you in today? Okay?
Okay.
So, what does bring you in today? What is going on?
Well, my knee has been hurting me for a really long time, about a couple of years now, and it just gets stiff and it swells every now and then, and it's limiting my abilities.
Your emotions. Okay.
Yeah.
Okay. So can you describe your pain? Is it a sharp?
More of a throbbing, constant throb.
Okay.
Not sharp, and it just seems like it's a kind of just annoying pain.
Just annoying pain. So this pain has been going on and off for a couple of years now.
Yes.
Okay. And how old are you?
I'm 16.
16. Okay. And when do you remember when this began? Like exactly what age you were?
I remember specifically around 3 years ago, I was trying to do cheerleading, and my knee was always hurting at practice, and to the point where I could no longer participate.
Okay. Okay. About the age of 13.
Mm-hmm.
So, when do you experience the most pain? During the mornings or night after a long day, or?
It's mostly in the mornings.
In the mornings, okay. Okay. And is this the first time that you've ever had any consultation with your knee? Have you ever been to any other physical therapy?
No, this is the first time.
First time? Okay. Great. Okay. So on a scale from 0 to 10, 0 being no pain, 10 being the worst, where would you rate it mostly?
Probably around 8 in the mornings.
Okay.
It's more of just being stiff and getting out of bed and trying to bend my knee all the way. It gets kind of stuck from where I'm sleeping.
Okay. Stiffness.
Yeah, but throughout the day, just depending on different days, it can be around a 5 or in the middle.
Okay, somewhere in the middle. Okay. And you mentioned you have a slight limp. Is there pain with the limp, or is it just because you can't go into full range, or is it?
There's no pain with the limp. I think it's more of just the swelling and the stiffness in my knee.
Okay, and you can't bend it or straighten. Is it straightening all the way?
Yeah, it's straightening from where I sleep, and then I try to bend out of my bed, and it won't go all the way. It gets stuck.
Okay. So, have you done anything to help ease the pain?
I've put an ice pack on it to try and decrease my pain, and take some over-the-counter medicines, but it still keeps coming back.
Just anti-inflammatories and things like that?
Yeah.
Okay. Have you noticed any skin irritations, any rashes or bruising in the area?
Sometimes it'll be red and warm around the area, and I'll see a rash come.
Okay.
Yeah, not every time, but
not every time. Okay. Good.
Yes.
Good. Have you noticed any weakness with standing or with doing any activities throughout your day?
Not any weakness. I guess from just where I'm not able to work out as much as I want to. I'm not as strong.
Okay. Does this interfere with any other activities? Or do you play sports? I know you said you work out. What about school and getting around?
Well, I have to go up the stairs to get to my classes, so sometimes it bothers me. It takes me a longer time to get to my classes, and when I have my limp, sometimes people will laugh, and so I'd like to take care of that and work on getting a better walking pattern.
Okay. Well, we can do that. We can help you out with that. And also, so just with walking, has it affected your balance, or just standing? If you have to stand for a long period of time, how has that been for you?
It's okay. Just standing. It's more of when I try and do activities and stuff like that.
When you actually add the action to it, that's when you notice the biggest problems. Okay. So, are you on any medications that I should know about? Any past medical history?
No,
that you
other
wanna
than
share?
the medicine my mom gives me
Mhm.
for my knee, the over-the-counter medications, that's all I
So
take.
that's it. Okay, great. Are you allergic to anything? Have you had any respiratory issues, breathing, or chest pain? Lately?
No chest pain or breathing issues, but I am allergic to, it's called sulfa. It's in
Okay.
antibiotics, so,
Okay.
yeah.
Okay. That. Okay. So, also, is there anything that aggravates this pain? Is there anything that makes this pain worse?
Just when I try and, um,
Specifically.
try and do my knee and just, I guess like when I do activities.
So just movement.
Yeah, it's just
basically.
an aggravating pain every day.
Okay.
Not really sure.
Okay. You don't know what it's coming from. It's just kind of it's there.
Yeah.
Okay. Okay. So we'll get that. So is there any other concerns or anything else that you would want to share with me that I should know about, as far as your goals or what you want to accomplish?
I just like to get more motion in my knee so it doesn't hurt when I do activities.
Okay.
And I also would like to decrease my limp
Just
and walk
decrease the
normally.
limb. Okay. Okay. Well, you've come to the right place. We're going to get started and get you back to where you want to be, okay?
Okay, thank you.
Okay. You're welcome. We'll get this going.